Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gwen Vaughn.
Welcome to the Auburn Medical Group YouTube live stream. Today about the nocebo effect.
That's right. Ooh,
Yeah.
Exciting.
Thank you, Dr.
Did
Gwen.
you mispronounce that? Was that
Nocebo?
Placebo or?
Oh,
because
yes.
most people probably haven't heard of that before.
Yes, let's bring that out. It's not placebo, like
I've heard of that.
Placebo Domingo. It's nocebo,
Yeah.
like nocebo flamingo.
Like Placebo Domingo.
What?
Not placebo
Sunday?
Domingo. That would be a relaxed Sunday.
Oh, gotcha.
Placebo Domingo.
Placido.
I think.
Placido, not placebo. Placebo.
I know if placido is
I think yeah.
Spanish word or not.
Placido.
Welcome to our program. I am Dr. Mark Vaughn. This is a mannequin. This is Dr. Gwen.
Oh, I thought you were referring to me. It's
No, my
like,
thumb is
wow.
going straight back.
And that kind of day, huh?
And we have Mr. Ed.
Hey.
And behind the controls, we have Holly. So we've got a full crew here, and we are going to go into a subject. This is a live program. People will be writing in chat while it's going live. If you would like to participate in that, you should subscribe to the channel and hit that bell icon so you get notifications. But usually it's almost every Monday at 4:30. Like in a year, we miss how many? A couple. So
Maybe 3.
Mondays at 4:30, maybe 3. So welcome. Thank you so much. My goodness, did you see the response to the show Remembering Larry last week?
Yeah, that was
We had
overwhelmingly
We had
positive.
like twice
enjoyed
as
that.
many views as a normal
Thank you for your feedback.
live stream. It was, wow, that was really, yes, thank you so much for participating in that. And thank you those who that was your
love
first show.
to his family and
Absolutely.
all those who cared about him.
Yeah. So we're going to talk about your blog post from drgreenknight.com.
Yeah. Which you should also
There's a
subscribe
link.
to.
And talk specifically about the nocebo effect.
Nocebo effect.
Perhaps it would be good to first greet our comments, the callers. They're not really callers, but the people who have been writing in since we got started. I know that Deborah Ronker did before we even got going.
Oh,
Deborah,
wow.
she has a special little thing on her comment because it's been 17 months that she's been.
Wow.
And there she
Channel
is
member.
right now.
Appreciate it.
Yeah,
Hi, guys. Feeling so much better. Glad you are feeling better.
excellent.
Yes.
I think she's talking to me.
Yeah, probably. I've been feeling pretty good.
I was the most recent one to be out with an illness, so thank you, Deborah. I'm glad you are better with getting over that pneumonia.
Pneumonia.
Other comments or
As
questions?
I cough up.
As you're coughing up,
Can't breathe.
your Dutch Brothers or something. So, okay, before we jump, can I do this? May I? May I just have a moment here?
I don't see anybody objecting.
Because there's like this delay, so I'll be done with the story by the time
By the time
object.
they say, no, don't do it. No,
So,
go ahead.
normally we love Dutch Brothers, but here's the thing. I wanted to try a caramel macchiato, and Holly wanted to get just our regular hot mocha that
A
we
mocha?
get. Yeah, small hot mocha. That's what we usually, I think we usually both get that. Or usually you get medium, but
Why don't we ever put a camera on Holly?
the second she says to do it, we'll do it. if you
Are
want
you
to
really
That's
that
by her
shy?
choice.
If you prefer being kind of the behind the scenes person, that's fine. But so we're getting a caramel macchiato. I wanted to try that out because I had one at a restaurant. It was really good. So I said, oh, if Dutch Brothers has those, we'll try that. So it's not on their menu, but the guy said, oh yeah, we can do that. So caramel macchiato and hot mocha. Caramel macchiato, hot mocha.
Seems like basic
So
orders.
they put letters on the lids, and I think even, let's see there, I think even
focused.
with it out of focus, you can tell what letter that is. It's a B.
B for
So-
caramel macchiato.
So one of the lids has an M on it, which is either for the mocha or the macchiato, and the other one has
Caramel macchiato. I can't even say it.
a B. Somebody tell me which one is mine and which one is Holly's.
What did hers have on it?
An M.
Oh, yeah, then it's mocha.
How come
So
it's not macchiato?
M for mocha.
B for
Caramel.
Guys.
I got nice coffee. So.
And you guys are doctors?
Anyways, we usually have a good experience. Let's not.
Yes, I'm sorry. I don't mean to. It was just that one guy at the orders. He was excited though.
They are always excited.
Yeah.
There's a.
So after he took our order, I didn't look at Holly. I just said, "Not him, Holly."
Was he hitting on you, Holly?
Not that my opinion matters. It's not my place, but okay. So
anyways, back to the nocebo effect.
A B.
When you take
what's the B stand for?
B?
Somebody tell me.
Anybody.
Write in. What does the B stand for?
Yeah.
I'm sorry. You were saying nocebo effect.
I was trying to bring us back to what we were talking about.
He's so good.
I try so hard.
He's so good. Nocebo effect.
The nocebo effect. Yeah, everybody's probably heard of the placebo effect.
Placebo Domingo.
I'm hooked on placebos.
I'm hooked.
And I could kick them, but it wouldn't matter.
Very good. Very good. Appreciate that. So yes, the placebo effect, the idea that if you give somebody a pill that has no medicine in it and is just essentially a sugar pill, that they will get an effect. And we see it all the time. Actually, it's now being studied to be useful to prescribe something that is a placebo for its beneficial effects, mostly in like chronic pain or IBS. We've seen it in some other things, which is kind of interesting that you're giving this open label, telling the patient, I am giving you a sugar pill, and they still get positive effects. It's pretty amazing. But anyways, we're not talking about the placebo effect.
So we are actually having informed consent.
Yeah.
Okay,
we tell people.
That's why I won't use a placebo, because you can't have informed. You can't honor the patient in them making a decision for themselves with informed consent if you're hiding from them that it's a placebo. You're right up front telling them.
Yeah, you tell them this is a pill that has no medication in it, but studies show, and you tell them that, studies show that if you take this, you will have improved symptoms, and the placebo effect does its job. It works.
Placebo effect, which is most of the positive effect that comes from homeopathy, naturopathy, a lot of chiropractic,
a lot of the alternative,
a lot of
medicine,
acupuncture, the waving of the hands thing,
Reiki,
or whatever it is, Reiki the lawn.
What? Yeah.
The exercise is good. Yeah. Then they get tendonitis.
So that is the placebo effect. But we're talking about the nocebo effect, which is its evil cousin?
Corollary?
The opposite, the fact that you can get a negative or bad effect, a side effect, from a medication by telling a person that they're going to have that. So, for example,
give an example.
So the common example is I prescribe somebody cholesterol medication, which is a statin, and statins commonly have muscle aches and pains. And I say, okay, you may get some aches and pains from this, and then they come back.
And they do.
Was that something that was caused by the medication, or was that a nocebo effect where me just mentioning that caused them to have it? And studies show that, I forget the percentage of the time, but a fair amount of the time, a statistically significant amount of the time, it is the nocebo effect.
And you know that because studies have been done where they enrolled the patient and said you'll either get the real thing or a placebo.
Yep.
And a lot of the patients got the side effect with the placebo.
Yeah.
So it makes it hard to treat them with the statin, because statins being one of the most prescribed medicines now.
Sure, yeah.
They've been around for a while, and some really good ones are available as generics. And when I say really good, here's what I mean. You can give a much, much lower dose and get the same effect on the cholesterol lowering and reducing the risk of heart attack and stroke. Much lower incidence of people having the side effects.
Right.
Much, because it's less milligrams they have to take, but apparently it's just as effective. So you can get with 10 or 20 milligrams of Lipitor what used to take 40 to 60 milligrams of simvastatin or lovastatin or pravastatin, And now you can get it with like 5 or 10 milligrams of rosuvastatin.
Oh man, yeah. Rosuvastatin's a good one.
Not usually as covered as well with the insurances. A lot of people that have it
Still cheap now, though.
normal insurance coverage, it'll be around like $4 for the Lipitor or atorvastatin and around $20 for the
$20.
rosuvastatin for a month's worth of it.
Yeah.
But we saw a really good price. Oh, we should tell you about this.
We're letting them in on the secret. That's what it sounds like.
Mark Cuban, who you might know from,
He's the owner of a basketball team.
he owns a basketball team. Okay.
That's right.
He also had HDNet, the first 1080 24-hour programming on satellite way back when high definition was
really?
new. I think that was Mark Cuban. And then he's on Shark. Lone Shark?
Yes.
Shark Tank.
Shark Tank. Thank you.
Very good.
It's kind of what they're doing.
Kind of what they do.
Anyway, I'm guessing he had a family member who had a bad experience with expensive prescription drugs because he started Cost Plus Pharmacy, and you can find it online by searching for Mark Cuban Pharmacy, which is how I find it.
It's a weird thing
But
to
it's
Google.
it's just a generic pharmacy, and I think they mail out of Hayward. Actually, it has an address in Hayward, right here in California. So really quick delivery times. It's a mail order pharmacy for generic only. So they have a very limited pharmacopoeia of just medicines that they got this good deal on that are generic. And I think it has all U.S. manufactured. I think that's a requirement of it.
I did not.
Or maybe
look that
it's
up, so
just
I
all
don't know.
filled in the U.S. You can check on his website and see. But incredible. Like, we looked up rosuvastatin, and it was
$18?
no.
Oh, that was the
No,
crossed
it was
out
it was
price.
$6.40 or something like that. It was under $7 for a month's worth of rosuvastatin. So for your generic medicine needs, you may be able to get as good a deal from Mark Cuban's pharmacy as you do from using your insurance at the regular pharmacy. So we're actually encouraging
Try it
patients to
out.
try it. We haven't done it yet. And he's not paying me to do this. I just I think it's a great idea.
Although, Mark, call us.
Yeah. Mark Cuban. No, wait, never met him, never talked to him. Nobody from his company.
After we just call him a loan shark.
We-
He'll be on the phone in no time.
Isn't it loans they give people? Isn't that what
Well,
it is?
Exactly.
they do all sorts of
They
things.
It's venture capitalism.
Well, they get some of their business, like
okay, so
some
it's
some stake in their business.
they negotiate what the deal is. It's
Right.
it's not necessarily 20% a month interest,
Right.
but
They get, yeah.
if you get some kind of generic medicine, check what their prices are and see, because it might be worthwhile.
Yeah.
But they don't have things like inhalers. They don't have those expensive
Those are tough to get,
inhalers that we're
yeah.
trying to get on the poor people with
There aren't really
chronic
any
obstructive pulmonary disease
covered.
and
Or in
asthma.
any generics even.
We're trying to get those combo lavas, and it's hard. We're doing a lot of that. You people with those medical problems with the lungs,
You know.
you know what we're going through because you've been
Yeah.
trying to get affordable inhalers for your medicine. And then other things that are often expensive, like eye drops. I don't know if they have a lot of those expensive eye drops. What else is really
I
expensive?
didn't look through there.
I don't think that they have novel anticoagulants like the Perdaxa.
Probably not. None of those
And
are
Eliquis
cheap.
type things.
Yeah.
All right. So sorry about that. I interrupted. Back to Nocebo.
Back to the nocebo effect.
Yep.
Where else do we see it? In the COVID vaccines.
COVID vaccines, yes.
Yeah.
So with vaccines, there's the VAERS, Vaccine Adverse
Events.
Event. Yeah, it's VAER, that Event Reporting System, VAERS. And so everything that a person has after getting a vaccine is supposed to be reported there. So tell your doctor, hey, I had this happen after a vaccine. You're supposed to report it. And so they send
They
in the
should.
VAERS.
Yep.
You can do it yourself, too. The patients can do it.
Yep.
And that's what the VSafe program was for, so that
Right.
patients could report their experience through text messaging is what it operated. In fact, I
I got another one.
got
too.
one this weekend.
Yeah,
Told
me
it,
too,
yeah,
me too.
I got COVID after my booster, so
That's
now
what
they
you
know.
said. They know.
They know now.
I said I was. The funny thing is, it always asks you. The last question is, how do you rate your health? Is it better than, about the same, or worse than before you got the vaccine? I don't know if it, how is my health? I don't know. I always say it's about the same.
I said it as
It's just an interesting question.
now that I'm over
Is my
COVID,
health
it's the same.
better? I'm still healthy. I no longer have hypertension or cholesterol, which I had beforehand. No, just kidding. Yeah. How many people answer that? My health is better.
I worked at losing a couple pounds, so I guess I'm better.
I don't know. Anyway, so when they did the studies for the COVID vaccines, they had two groups, obviously, those who received the actual vaccine and those who received a placebo. In this case, a saline injection. And then they had the people report their adverse effects. And they found that there was a lot of people who had just got saline who had a lot of similar side effects to the vaccine. So those would all be nocebo effects: injection site pain, redness. You should not get any of those. With just a little
injection site pain when you got an injection. Would that actually be nocebo?
I guess not.
Sounds pretty real to me.
If it's just, I guess a little saline going into the muscle, but like redness, fever. Things like that.
Yeah.
You should not get from just a saline injection.
No, shouldn't. You're right.
So then there were other things as well, even more systemic reactions: the fevers, the chills, the myalgias, which some people
Blindness.
get. And blindness, that one, that common reaction.
Inability to pass gas.
Man, just exploded.
Laura Barzyk.
Laura.
She says, I don't know how you people without insurance do it. My inhaler is over $400 a month. Luckily, I got a manufacturer's coupon.
Well, that's part of it. There are some of those.
All a game. Those coupons.
Yeah, some of those things out there like GoodRx, or you can get some discounted discounts on it.
For things that aren't on the Mark Cuban Pharmacy, GoodRx and SingleCare.com
Those both
would be places to go, and anybody can use those. You don't have to have the card. You can just use the number that's on the website for GoodRx.com or SingleCare.com.
Here's a great question.
There's others.
Terry Hockman, how expensive are the placebos? Asking for a friend. That's wonderful. So what you do is you go and buy
Terry.
a bunch of Smarties.
Yeah, seriously.
And then there's your placebo.
Unless you're treating diabetes with it.
Don't.
Smarties don't work well to treat diabetes.
I'm taking this placebo.
Oh, and Smarties can also be taken either PO or PR.
Literally a sugar pill. It's all it is. Sugar.
They make you smart.
But did you ever do that as a kid? Light up your, I don't know why.
He's not explaining
Why do we
PRs.
do that as a kid? Like say, oh, these are my pills.
You mean grind them
like
up
my
and
kids
snort
do it too. Grind them up and snort them?
Smarties?
What kind of childhood did you have?
What?
You're snorting your
You guys didn't do that?
No. Watch out there, Doc.
No. I just carried them in a little baggie in some place that you're not supposed to know about.
Maybe the school district I grew up in wasn't as good as I idealize it to be.
We're going to have to watch out for fentanyl and Smarties now.
Fentanyl and Smarties. Oh my goodness.
Oh my goodness.
That's okay.
Yep. Yeah, but even my daughter, who's 5, she'll get her little Smarties.
And she
take my
grinds
pills.
them? Oh, no! Even my daughter. You said even my daughter after we're talking about grinding them up.
I was talking about just calling them, referring to them as pills.
I'm picturing her now.
Pills. Maybe it's because she's
got like one little finger against her nostril.
Yep. I'm good. Dad, time to go to school. Let's go. I'm ready. Let's do it. Oh, my homework's done. How about you? Are you ready?
Okay.
Lindsay wants to know, whoever is down, just snort a few lines of Smarties. Let's go.
Oh,
Okay.
Yeah, that's
So,
bring it back.
when administering Smarties rectally, you would take them out of the wrapper.
Unless you're trying to smuggle them into prison.
Smuggling the Smarties.
Who's my pills?
Wow, look at Laura. What did we get from Laura just now?
What? Oh my goodness, Laura.
Wow!
Look at that.
I don't understand. $49.99.
Whoa! Hey, all right.
It's Canadian.
Oh, okay.
Yeah.
Canadian.
Yeah, I think that's what's going on there. But thank you, Laura. We appreciate that. And
man.
that will buy a lot of Smarties, I'll tell you.
Crystal says, I did see a kid snort a pixie stick once.
Yeah.
Oh, because it comes in a stick. What else are you supposed to do with that, right?
Did not seem to
You
enjoy
rip off both sides.
Which orifice is appropriately sized to stick the pixie stick
the
in?
nose, absolutely.
That's right. But then you get those big old long 3-foot ones.
Oh,
Those
man.
pixie sticks.
That's like
It's like,
what do you call those? They're not flexible sigmoids.
It's a good
It's called
half-inch
a
diameter.
rigid sigmoidoscopy.
Oh my goodness. Snorting that would be, boy, that would be a hit.
You know, we are. This program is not appropriate for children.
It just turned into it.
We have to mark a different box on the YouTube when I said it.
Yep. Now we need to. So, anyways,
we would feel bad if
Not safe
kids
for
got
work.
hurt because of what we're
I
saying.
would feel bad. So
maybe we shouldn't suggest it. Well, I never did suggest it. I was just reporting the facts.
We were saying that was bad. You would never do that.
I'm just
take
asking
your
the questions.
Smarties. I'm just okay, Tucker.
I'm just asking the questions.
Oh man.
All right. So the nocebo.
Nocebo.
The cardiologists tell us encourage your patient who had the muscle aches with the statin to try it with another statin. And so often the direction we'll go is one that requires a lower strength, like the rosuvastatin that you can get at 5 and 10 milligrams.
Yeah, you get a better
Try
effect.
it again, and oftentimes we have success. Why do we do this? Because statins do reduce the risk of heart attack and stroke in select populations. Those people who are at high risk are the ones that you're going to make a difference in. Because if you lower the risk in half from somebody whose risk is 3%, that's not much of a reduction.
Right.
But if you lower the risk in half from somebody whose risk of having a heart attack in the next 10 years is like 40%, that's a reduction.
Going to make a meaningful difference.
We do use a lot of statins because of that, and we actually do have very little harm come to patients from it. Some people have been harmed by statins.
Sure.
But it's very few.
Rare.
And it's much more rare than it used to be. And we also check
use them so much. Yeah. Like every once in a while, I have somebody who has a true muscle problem from it. You know, that's
they do exist.
You check
often
their
enough that we've both
labs
seen it, but it was from the old days.
You
you don't see it much
guys
with
are
the new
scaring
ones.
me. You got me on statins, dog.
Yes. How do we turn this around so that
How do we bring this back? So why is this information useful? How about that? Because sure, if there's a few ways we can go with this. One is, as a doctor, should this affect my practice? I mean, informed consent is required. We need to let our patients know the risks of the medications we're giving them. We can't just not tell them those things. We should let them know. And I don't know your practice, but at least in my medical school, you should, if there's a very bad risk, you should at least let them know about that. And then if there are common risks, you should let them know about that. But you don't need to list out the 20 different things.
You don't go to that thing at the bottom of the list that somebody wrote one time happened that nobody thinks is connected to it.
Yeah.
But things that are common.
Incontinence.
Yeah, you should probably talk about the common effects that a medicine has when you prescribe it.
And that's why I mentioned muscle aches with
But also
statins.
with this list, like people watch the television commercials for the drugs. People
Those
watch
are fun
television.
to, I mean, it's so common that people, it's kind of
It's a joke.
parody at this
I mean,
point.
yeah. So what that doesn't include is any kind of perspective whatsoever. So that information can't be used in a practical way by the patient. Our job as physicians is to supply, and probably the pharmacists too, supply some perspective.
They give you the paperwork.
Let's not look at the big whole long list that's endless of horrible bad things, including oily discharge and death and things like that. Let's instead say, what is it that we actually in our practice have seen come from this drug? What are the things that we've seen often enough that they come to mind when we think of that drug? Oh yeah, look out for the swelling when you take the amlodipine, because we see that. Not that it happens in most people, but it happens often enough that a medicine we prescribe commonly, we see this side effect.
Yeah. And I mean, by law, we can't change that. we need to give.
You're even scaring me more.
Informed
You got me
consent.
on amlodipine as well.
Do you have,
We're just going to go through your list.
do you have swelling in your ankles right now?
Oh, no.
Okay, there you go. See? We're good. And that's the usual.
Yeah.
The usual side
Most people
effects.
do fine. So, we can't change that practice. But the reason we bring this up is because mindset goes a long way. And
Big part of what we do.
yeah, if you go into something with the mindset that the doctor listed these things out, and I'm probably going to have one of those because I get every single side effect in the book, then maybe you're predicting your own future there. However, when we prescribe something, I like to think, that I've gone through the risk, and I do, I go through the risks, and I have made the decision that the benefits far outseed any risks of taking the medication before I prescribe.
Did you just say outseed?
Far outseed.
Far outseed.
Far outweigh. Far exceed.
Exceed.
It's a combination word.
That's funny.
Now I know how it happened.
It far outseeds.
I couldn't even.
You couldn't even figure out.
I couldn't come up with how did he
come up with that? I combined two words there.
Exceeds.
Fine.
Outweigh. Exceed.
Outweighs or X-ways.
Far
X-ways.
far
Outseeds. Goodness. Oh, man.
That
Forever documented on YouTube.
It sounds like artificial insemination. Far outseeds.
Far out. But they're far out. It's
foreign.
Like foreign.
European artificial insemination. Far outseeds.
Oh, I was thinking that's what they do when you go take it up in the saucer and they probe you. You get outseeded.
Okay.
Anyways, yes, we have made those calculations in our mind when we prescribe something.
I want you to read Deborah's.
And you need. Okay,
Are we getting
Bill, let me
unsubscriptions from
finish.
this?
Just that. Trust your doctor. That's kind of where I was going.
Oh
with
no! When they behave like this.
When they can't say words, can't even put two and two together. What did she say? Would you have multiple doctors, cardiologists, etc., like I do? My primary doctor gets to know any other prescriptions I need, so he controls all my medicine. Yeah, you make a good point. So as primary care doctors, like we are, our job is to essentially play quarterback.
Keep those cardiologists in line.
Between all those. Because sometimes a cardiologist will prescribe something and maybe not know that you shouldn't be on that for another reason, for another health reason. Or your nephrologist has prescribed something and that cardiologist prescribed something that interacts with it. We should know all those medications so that we bring those up and we catch those.
Yeah.
Because specialists, well, they're pretty good at being mindful of other conditions and other medications. Sometimes they overlook it, and sometimes they're just focused on their specialty.
And with a lot of geriatrics practice.
Wow.
He looks at me because
I'm out of here.
He looks at me because
Our job is actually to protect patients from polypharmacy, which.
Who's that?
I don't know.
Who's Polly?
Cardiology.
Yeah. So if you have a heart attack, how many medications are you walking out the door with?
And all my cardiologists, who I love, and I do, we have friends. I mean, I have their numbers on my phone, and they answer them because we appreciate them, and we do appreciate you. But I will have conversations with you about polypharmacy and how your guidelines just pile on medicine after medicine after medicine. And elderly patients
and it's not just
do
that.
better with less medicines.
There are the guidelines out there for diabetes. If somebody gets diabetes, they're already and they're needing medication. Automatically, you've gone
like
3
Smarties.
medications down.
Four,
if you include asprin.
Yeah.
Smarties.
So we're just going to give them Smarties for their diabetes.
And then you add the Smarties to the diabetes. Good call, Mr. Ed.
Give them Smarties.
Smarties for
and
diabetes.
Then you're going to need insulin.
Laura wants to know what's in these Dutch Brothers.
Oh, man.
It's just caffeine.
It's a
sugar.
B. Something that starts with a B.
I have a friend who owns a coffee shop, and he calls Dutch Brothers. Well, he says that's not coffee. That's just coffee flavored ice cream.
That's about right. I had an iced coffee. There was.
Yeah, yours was low cal compared to your usual.
Maybe that's why I'm so
Level-headed.
But I would say that this one had more caffeine than I usually get, so maybe that's why I'm a little.
You let me get away with.
Is that why it's sweating? No, because it's hot in here. Because they left the lights on all
Somebody
weekend.
forgot to turn off the lights.
Whatever it was in the coffee, they're
the
enjoying.
coffee.
They're enjoying you guys very much.
So we need to just get
The
that.
audience seems to be enjoying it.
They do too. Yes, indeed.
They're having their
goodness.
own little conversation.
Yeah.
I think it's somebody write in. What did you think of the thumbnail for today's show? Because it's
If they saw it, yeah.
it's eye catching.
That is a YouTube thumbnail.
We have a pretty good audience there. Yeah,
that was before I had caffeine. The before and after, you can check.
like mine looks like I had it. Yours looks like it's
Yep.
before.
I may be talking.
Yeah.
Am I talking faster? I don't feel it. I don't feel anything at all. Am I talking faster?
Should we have them guess what the bottle is?
Maybe it's that Pixies tick I snorted before I came on the show.
Laura comes back with saying, my pharmacy always checks for any negative interactions
Yes.
of a new medication with my existing.
And thankfully, our EMR checks also. Every time we write a prescription, if there's an interaction.
Oh, is that the box that I just click ignore? No, I'm just kidding.
No, you bring up a good point, though. When there are so...
Oh, you get a little
okay, so they
warning
are,
fatigue.
Warning fatigue. There are so many drug interactions.
Whew. Yeah.
And some medicines are on. Well, how many drugs are old people on?
Why do you look at me? Okay, I'm going to be 79 this year.
We're going to lose an announcer and a patient by the end of this session.
And our audience. And my license. Wouldn't that be funny if, like, the state board is reviewing the horrible stuff we're saying here, and they're playing this, and, like, members of the medical board are like, they can't help but laugh at it.
Whatever you don't want to see on that big screen when you're in front of the jury.
They actually teach that in medical school. Anything you write in the chart, how would you feel if it's projected on a 10-foot screen in a malpractice case? So think about that. And I teach our students that too.
Right.
Of course, the audience is saying, well, wouldn't the better thing be just to not do?
If you made it this far with us, please don't snort any medications or candy or just put that razor blade away.
Illicit drugs, none of them.
Oh yeah, don't do drugs either. Those are bad for you as well.
Don't do candy or drugs. In that order.
To answer your question, though, it's 5. You got me on 5 minutes.
Oh, he's answering now. Okay. Why did I ask that again?
That's probably about average.
What were you talking about?
You were talking about the average number of medications.
I forgot my Prevagen.
What is that? What is the? I mean, I forget what the number is. I think it's 8. But they say when you get to 8 medications, the probability of having a medication interaction is almost 100%.
Yeah, I think after 4, it's
really
already over 50%.
Yeah.
So back to warning fatigue. Is that what you said? Warning fatigue? We'll say warning fatigue. So there are so many interactions that are documented that could happen that almost every time that we're hitting the button to send off an order for prescription, a warning is coming up of something, whether it be that the patient's allergic to something in that class, which may be that they had some kind of reaction unrelated to it, and it's not actually an allergy most of the time anyway. Certainly not anaphylaxis.
Right.
It could be that
one's in red.
Okay. What are some of the warnings? Some of them don't even have to do with drugs. Some would be like they shouldn't take this with alcohol.
That comes up.
What's another one that we've seen that doesn't even have to do with the medicines that will come up? And of course, then you'll look at what the actual medication interaction is. Like, look at it and you'll see, and it's totally irrelevant to what the patient's doing or an insignificant level of concern. And then there's the real, hey, this patient had a really bad reaction to this. You shouldn't put them on it. And that's the one that you don't want to just ignore and hit. But because we're doing so many refills, so many prescriptions, that when little extra windows pop up before you send off the medication, it is... Sometimes I'm having to go back because I'm so much in the habit of just get through it.
Yeah.
You have to go back when you see like, oh, that was a red one. Oh, okay, let's call a pharmacy and cancel that one.
I need to take that seriously.
Yeah, so, there's a lot. Yeah, the patient is concerned. He's worried.
Oh, yeah.
And it's not just our practice. It's anywhere that has an EMR. But you'd rather have the EMR and have those warnings coming up than have flying by the seat of your pants, hoping that you remember all of the interactions of the different drugs.
It's impossible.
So it's more of an art than a science, the practice of medicine in this age.
Well, Lindsay says she's already rolled up the dollar bills.
Make it rain.
Yep.
She rolled them up.
She's talking about you, not me.
Ready to go across what? What? No, that would not be rolling up the dollar bills.
Oh, that.
Yes. Snorting, Doc.
I know the lingo, you kids.
Oh, man. Yeah.
It's a 20, right?
$100.
Depends how much of a high roller you are, I guess. I don't know. I have literally no experience in this.
If it's a fentanyl, it's a Franklin.
What?
Nothing. Okay, thank you for joining
way
us.
Too much about this.
You've shown great patience if you stayed through to the end.
And we'll turn this off and have a nice little intervention
we
after this is over.
We found out that our YouTube videos are supposed to do better as far as expanding the audience if people watch all the way to the end. So if you have to go do something, let the YouTube keep playing on whatever it is while you do it so that we get credit for it. Thank you to our patrons. If you like the idea of having your name associated with this kind of questionable content, then when the names go over here in a little bit, you can get on Patreon,
They endorse
patreon.com.
every word we say.
/Dr. Vaughn, there's a link. And also Dr. Gawain has Dr. Green Knight. And who do you want to thank?
Yes, Teresia Rowatt, thank you for what you do over at my Patreon. I appreciate it.
And I had communication with Lindsay that told me that we are, supposed to mention her.
Okay.
Thank you, Lindsay Antoine.
Thank you.
And until next time, all of us here telling you to stay in good health.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.